All right, so I thought I would talk about kind of a controversial topic, which is used to be called multiple split personality disorder, but it's called dissociative identity disorder. So dissociate, detaching, you have a different identity. So this is used in extreme trauma, particularly in childhood, where someone can reassign a. I mean, I've had one patient that's had it, and it's very unique. Meaning the person would be two people, but they didn't have the same characters, but it was the same person. So I know it sounds interesting, but in this case, there's going to be a guardian, right? So someone that talks and expresses is going to be a weak, depressed person. So it develops during severe developmental pressure in high stakes and punitive environments. So a way to escape the environment is to be a different person. So why did DID develop this way? The guardian part, the protector, caretakers, these identities emerge to handle situations the child or the host cannot endure. In these hyper-religious, punitive households, a child may need, which can be one factor that leads to DID, is these very rigid environments. A child may need to be perfect or bold persona to avoid punishment, or a guardian to provide the protection they need to receive from their parents. So the person's identity is the guardian of the weaker version. So the weak version, the primary identity of the host, often carries a weight of depression and helplessness. This part is frequently passive and dependent, while the trauma and anger are sequestered into other identities to allow the person to continue functioning and being accomplished in daily life. Hyper-religious upbringing. So authoritarian or rigid parent style is significant factors of DID. This extreme pressure to meet impossible standards can lead children to split off in parts of themselves and do not fill in the religious mold, such as their own anger or sinful thoughts. Now, as a kid who's dissociating, you would wonder, well, what are the parents? So, dysfunctional dynamics. Parents with these families struggle with their own emotional regulation and may be the original source of trauma. Denial and deflection. They may act lax because they're dissociating on their own past, so it could be intergenerational trauma, and they feel burdened as the patient's current needs, burdened by the patient's current needs. Some families view the symptoms as attention seeking rather than legitimate crisis, which in my patient's case, the parents were very lax and neglectful, and in my mind, it was very dangerous. But that's their decision. So the first documented case of matched DID was in 1584 by a woman named Jean Ferry, and was thought to be framed as demonic possessions of time. Later in 1882, a man by the name of Mr. Vet was officially diagnosed with multiple personality disorder, and there have been others that have been described as having split personality. So the basically development of DID in children's personal failings integrated into a single cohesive identity is due to severe stress. Children under the age of 6 to 9 often use magical thinking or imagination to cope with this inescapable pain. By dissociating, mentally checking out, they distance themselves from the trauma, essentially creating a not-me experience that eventually fragments into a distinct identity states, alters. Disruptive integration. A child's version of these self states merge over time. Chronic trauma prevents a natural fusion, leaving the states separate.